Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we get to talk about Lyme disease. Hopefully, we can find some solutions that might help move your treatment forward as well, too. For those of you that are new here, welcome. And those of you that are returning, I'm glad to see a lot of familiar names back here again, too. The way you participate is two ways. Number one, you can listen to the questions as I read them and as I post them on the screen here in the live version, at least. And you can see what answers I give. That's one way. The other way, you can actually write questions to me. And you can do that by posting your question in the chat box on the lower right-hand side of your screen. The only thing I ask is that you don't hit the enter key multiple times to create paragraphs. Just write your question as one big, long, run-on sentence, because each time you click that enter key, it sends a separate question to me, which gets to be very complicated to follow on my side. During the webinar tonight, I will be posting those questions on the screen where you can read them. Realize, though, that in the recorded version, they don't record. So I'm going to read them out loud so that everyone can hear them. I am creating a recording of tonight's webinar, and tomorrow morning, my intention usually is to get that out to people by around 9 or 9:30 in the morning. Last week, I was delayed in doing that, but that's usually what my intention is. So keep a lookout for that tomorrow morning. You'll get an email from me announcing that it is ready when it's ready, okay? I have to do some edits on it tonight, and then I always try to write a brief summary about what we discussed as well, too, okay? So look for that tomorrow morning. And then, see, next week, I think next week I'm going to be off on the webinar. I haven't scheduled it yet. I usually take a week off after each month, and I think that will be next Thursday. But I have to see what the rest of the schedule looks like on the webinars, because I know later in the month I'm traveling back to Indiana to see my dear old mom in Fort Wayne, Indiana. I believe that falls on a Thursday, and if so, that'll be a Thursday that I'll be taking off. So I have to figure out how I'm going to schedule this. So just tomorrow morning, when you get that email from me, there will also be a link to sign up for the next series of webinars, and you'll be able to see what I decided in terms of whether there's going to be one next Thursday or not. Okay, so keep an eye out for that too. Let's see here. I don't think I have anything else to say. Let's go and get started, because I always have something to say when you ask me your question. So let's take the first one here. All right. Hello, Lynn. Let's see. Hi, Dr. Ross. It is an uncommon occurrence, but I got shoulder injury related to vaccine administration about 2 months ago. I hadn't even heard of that acronym before, SERVA. Okay. Thanks for writing that out so I understood that. There is inflammation and possible tissue damage to the tendons, ligaments in my shoulder. I'm taking the Meriva curcumin for inflammation, but I'm wondering if you have any other suggestions for supplements or other methods to treat the inflammation and tissue damage. Last week, you talked about the peptide BPC-157 for repairing nerve and joint tissues. Would it also work for tendons and ligaments? What do you think about things like cold laser therapy, infrared therapy, ultrasound, or PRP to speed healing to these tissues? Okay, good question. So at the cornerstone of this is probably some degree of inflammation. And so first of all, I'm sorry to hear this happen with you. Let me start by saying that. But I would focus on trying to get inflammation down and then promoting healing. And that's what you're suggesting by your question as well, too. In terms of getting the inflammation down, I would keep working with that, the curcumin, which is the Meriva 500. Curcumin, as many of you know, is anti-inflammatory. And I would do 500 milligrams 3 times a day. The other thing that might be helpful, actually, is to add in some glutathione. And I would do a liposomal variety of that glutathione. Liposomal means it's glutathione that's more easily absorbed because they prepare it by mixing it in fat to increase its absorption. Glutathione is the master reparative antioxidant that is made in every one of our cells. And in addition to helping repair damage like this, okay, it is useful at helping with detox, and it can get inflammation down too. So the product I would use for that is a product by Research Nutritionals called Tri-Fortify. There's a Tri-Fortify orange, a Tri-Fortify watermelon. Just pick your flavor, okay? It's flavored because glutathione has a lot of sulfur in it. So you're trying to cover up that sulfur taste. And you want to do 5 milliliters. I would probably do twice a day for a couple weeks, and then decrease it down to 5 milliliters one time a day 5 milliliters is the same as a teaspoon, okay? All right. And then other therapies that might promote healing, although I haven't used it in a situation like this, the peptide, the BPC 157 you're talking about, which is a peptide that originates in our stomachs, but it has been manufactured in pill form as well too. That peptide is known for repairing damage, nerves and musculoskeletal damage and joint damage as well too. So it could help. I can't guarantee it will help, but it could help in theory. And the way I would do that is one pill 2 times a day. The company that makes that in a pill form is Integrative Peptides. And for those of you that are not aware, you can find that at my supplement store. I'll show you where that product is here in a minute. In terms of other things you might try, I'm just looking at what you listed here. You know, I would probably work through physical therapy on this, and the treatments they probably would wind up using would be some ultrasound. I think that might be beneficial. The other thing you might even consider doing that can be useful in situations like this is acupuncture, actually. If you can find a good acupuncturist to work with. Those are some thoughts. And so, yeah, take a look at those and consider the acupuncture as well, too. Okay. All right. So, everyone, let me just do a quick screen share here. Yeah, this is my store, Marty Ross MD Supplements. In terms of this BPC 157 product, it's made by a company called Integrative Peptides. Let's do it that way. And this is the product here. Okay. I just want to let everyone know. So evidently this Integrative Peptides, this is the new bottle, the new labeling that they have, but they still have some of their old product bottles that they've sent to me actually. So their product, the old product bottle that you would get if you order from me is called BPC 157, which is the same as this. They just rebranded the name on it. Okay. But anyhow, this is it. 1 pill, 2 times a day. Okay. All right, let me go back here. All right. Good luck to you, Lynn. Thanks for that question. Hello, Sharon. Sharon says, hello, Dr. Ross. Thanks for saying hi, Sharon. Hello, Jim. Let's see. I realize that Lyme treatment is very specific to the individual, but generally speaking, what is the most important thing a chronic Lyme patient should do? Also, what would the next few key things be? Thanks. So I like how you said that. You know, it's, I mean, the big thing is kill your germs. I mean, you got to get your germ load down. Okay. So that would be like one of the primary things. And then I guess the second and third most important things would be is control your cytokines. You want to work with cytokines because lowering them will help your immune system work better. Okay, so what are cytokines? So cytokines are good and bad. Cytokines are chemicals that are made by your white blood cells when you have an infection or if you have too much mold in you. They're basically made by white blood cells to try to tell the rest of the immune system to get on board and start helping out. Okay, they turn on the immune system. But if the immune system is not doing a good job, it will wind up trying harder and harder. Eventually, it can make too many cytokines. Too many cytokines give you pain, make it so you can't think, give you fatigue, cause sleep disturbances, etc. I mean, all those symptoms that we call Lyme symptoms are triggered by too many cytokines, and most of them are too many cytokine symptoms, okay? The reason to lower the cytokines is to help you feel better, but the second reason to lower them is if you start making too many cytokines, it can create immune suppression in terms of your ability to fight infections. So you want to get the cytokines knocked down too to help your immune system work better, okay? The third most important thing I would say is get sleep. Now, that may sound crazy because I know some people with Lyme, that is just the nightmare situation is trying to get sleep. The reason people have difficulty getting sleep in Lyme is that the cytokines cause disturbances in the sleep centers, okay? All right, but here's the deal. If you get sleep, it can help lower cytokines. So cytokines cause poor sleep, and then poor sleep leads to more cytokines. So you just get into this loop. So sometimes you have to use either herbal medicines or you need to use prescription medicines as well to help get that sleep. Okay. And a good goal for sleep is 7 to 9 hours of sleep. All right. So those are three key things. But there is, to tell you all the things I think a person should do that I consider key, take a look at the Ross Lyme support protocol. So let's go ahead and do that, because I've listed out what I consider key steps to do throughout a Lyme treatment, okay? So, or things to address. So let me do a quick screen share here. All right, so let's go. Okay, so this is my Lyme disease information site, and Treat Lyme by Marty Ross MD, and take a look at my treatment protocol here. And this is where I identify the key steps you need to do in a treatment, okay? So number one, once you get all the way down here, step one is do things to get sleep. Step two is I do suggest that people be on either an elimination diet or a type of paleo diet, and that's this diet here. Number three, get your cytokines down, like I was mentioning, using either curcumin or something called cytoquel. I like people being on things to help their bodies deal with stress, and so for that I like using an adaptogen called ashwagandha. Number five, work to fix your hormone imbalances. Be on a good multivitamin. Do some basic detox by being on glutathione. Exercise if you can, if it doesn't hurt you. At this point, my protocol doesn't call for specific immune stimulants, but getting sleep, being on a good diet, lowering cytokines, being on an adaptogen, correcting your hormones, being on a good multivitamin, etc., all helps your immune system. So that's how I suggest you support your immune system. If you have too many intestinal yeast, get them out, and then treat your Lyme infections and treat your co-infections, okay? Those are the 12 essential steps that I try to address in everyone right there, okay? All right. All right. Thanks for the question, Jim. Good luck to you. Hello, Kara or Kara. I can't tell by the way it's there, but either one of those. Let's see, have you tried using allicin in the treatment of Lyme and co-infection? What results have you seen? Also, do you know which one of the available COVID vaccines are least likely to create an unfavorable reaction in someone who has autoimmune issues from Lyme and co-infections? Lastly, are you excited about the recent research on the hygromycin A? Okay, so let me, I'll be going to talk about each one of those. Let's start at the top. In terms of allicin is the chemical that comes from garlic, everyone. And it can be a good germ killer. Where I find it most effective actually is sometimes I use it as part of my yeast treatments for yeast intestinal overgrowth. In terms of whether I see it give good results on the Lyme germ, Bartonella, or Babesia, I generally don't see much results there, to be quite honest with you. So where I tend to use it as a component in treating yeast, and I tend to find it best just to have people eat raw garlic rather than taking expensive pills. The raw garlic, I think, has got more active chemicals in it that help even than the allicin itself, okay? Let's see. In terms of the available vaccines that would produce an unfavorable reaction in people with autoimmune illnesses, I don't favor either one of them. In general, though, what I want to let you know is I consider the Johnson & Johnson to be a weaker vaccine at preventing bad outcomes from COVID than the Pfizer and then the Moderna vaccine. Okay, so I would just say that. If people have a choice in my practice, even those with autoimmune illnesses, I have been advising that they either get the Moderna or the Pfizer. The more recent data coming out would suggest that probably of those, the Moderna is even the stronger one. Okay, so that's what I recommend to my patients. Okay, all right, and then let's see. Recent research on hygromycin A. So hygromycin A, everyone, is caught the world by storm, and the world of Lyme is on fire about this new possibility. But I'm going to call it a possibility, and so let's talk about it. So hygromycin A is a substance that comes from soil. And Dr. Kim Lewis, who's a researcher at Northeastern University in Boston, has been trying to figure out what can we do to get rid of Lyme. And he was doing, from what I understand, he was running tests based on substances he was finding in soil to see if it would kill Lyme. He found that this substance called hygromycin A worked well on laboratory experiments killing Lyme, and then he tried it in mice and it looked really well too. The thing that's interesting about it is it does not appear to target any other bacteria in the body, meaning you might be able to use it to kill Lyme, but it would protect your gut microbiome from being destroyed by the antibiotics in a sense, okay? Now, we don't know yet whether it's going to work in a human, okay? And in fact, it is not approved for anything yet. It is a substance that was known of before, but he's the first one to show that it would work against Lyme in laboratory experiments. So it has been, my understanding is it's the rights to hygromycin A have been licensed to a company called FlightPath. FlightPath is a startup, if you will, a pharmaceutical company that's developing novel treatments targeting infections like Lyme. They also are the ones that have been developing are looking into using another substance called azoles that some of you may be aware of. The company that's developing that also is FlightPath. Okay, now the thing about the hygromycin A is because it has never been manufactured or approved by the FDA for any purposes in the past, it has to start right at the beginning. They have to do a bunch of research involving phase 1, phase 2, and phase 3 trials, clinical trials, and to see if it's safe and if it works. And so they're just at the beginning of that process. And I think if everything were to go smoothly, and that's if everything goes on time, we're probably talking 5 to 8 years before we see a drug being produced that could help people. And the jury is still out. It's not clear. There's no human studies done yet to know if it works. Okay, now let's talk about azoles, which was discovered by Dr. Rahadis's lab out in Stanford University a couple of years ago. And it has been shown to treat persister and growing Lyme. And it worked well in laboratory and in mice experiments as well, too. Now, that one is an FDA-approved drug. It's already approved. The trouble is no one's manufacturing it. And so FlightPath is now doing, I believe they're doing some human studies trying to figure out if it really will work in Lyme. And if it does, they could get up to production a lot more quickly because they don't need to seek FDA approval to manufacture and release it to the public, okay? So that process may go a lot faster, and we don't know about that one too. But in terms of potential prescriptions that we can use that are catching everyone's attention, one of these would be the hygromycin A, and then this azoles discovered maybe a couple of years ago is the other one that's in the pipeline. So I'm just trying to follow what FlightPath is doing and see if they're going to be able to move either one of those to market here eventually. Okay, all right. So thanks for that question, Kara. Good luck to you. Hello, Rich. Let's see. These webinars are great. I'm glad you're getting some benefit out of them. Thank you. Thanks for doing them. Could you give advice on what might be causing cold and clammy legs, especially in the front of the thighs? I'm not sure, but let me discuss a couple of things with you. So there is a phenomenon in Lyme disease that also occurs in rheumatologic disorders as well, too, which is called Raynaud's phenomenon. And in Raynaud's phenomenon, you basically can get periods of lack of blood flow going to the hands, the fingers, and also to your toes and your feet, okay? And what we think happens in that situation is you can get periods where your blood vessels go into spasm, limiting blood flow. And the things that cause them to go into spasm can be temperature changes, either getting into hot or cold, okay? For those people, usually trying to manage temperature variations, what works best. So wearing gloves instead of letting your fingers get cold, for instance. From a prescription medicine standpoint, what can help is to do blood vessel spasm blockers like a group of medicines called calcium channel blockers like Procardia, Norvasc might help. Using nitroglycerin might help with that. And so that's kind of the conventional approach. From a natural medicine approach, what I like to use in those situations is to use ginkgo biloba. Ginkgo biloba helps blood cells flow more easily through real narrow spaces, so you still get good blood flow even if the blood is in spasm. And that would be 80 milligrams twice a day is what I usually will have people do for that. Another idea, though, that I've been more recently adding in when people have Raynaud's phenomenon is to also have them use lumber kinase. And the reason I would use, so lumber kinase is a group of enzymes that are made by earthworms, and they can break down fibrin. And in this case, when you have chronic infection, one of the things that can happen in some people is that you can get thickening of the blood because the immune system will over-manufacture fibrin. Fibrin actually is a reactant made by the immune system when it sees an infection sometimes. It also happens to be made as part of the blood clotting mechanisms in the body. And it's a protein fibrous compound that can hold together platelets in blood clots and in scabs, if you will, okay? But in people with chronic infections, they sometimes overproduce fibrin as they get thickening or stickiness of the blood, and that would limit its blood flow into those narrowed areas. And so in addition to using a ginkgo, I might use lumber kinase 20 milligrams twice a day, okay? Now, the situation you're describing is not in your digits or your toes, but it could have that same kind of quality. It just may be that in no areas is where you're getting your spasm. I'm not quite sure why. And the two things I would consider trying for what's happening with you would be try the lumber kinase 20 milligrams twice a day. And in addition, you might look at trying a ginkgo biloba 80 milligrams twice a day and see if it does give you some benefit there, okay? You might try it. I can't guarantee it will work. If you were my patient and I had somebody with symptoms like that, that probably wouldn't be what I would try, okay? All right. Good luck to you. Hello, Anna. Let's see. Hello, Dr. Ross. Does itraconazole oral capsule for the treatment of intestinal candidiasis treat also vaginal yeast? Does the medicine kill beneficial yeast in the body? And do you need to supplement with Saccharomyces boulardii after the protocol? Thank you kindly. So itraconazole is in a family of antimicrobials known as the azoles, okay? So the azoles include fluconazole, which is diflucan, itraconazole, which is also known as Sporanax, ketoconazole, which is also known as Nizoral, and let's see what else. There's some other one. Oh, voriconazole would be in there as well too. The other ones that are in that family, interestingly enough, are the azoles of metronidazole and tinidazole, which we tend to use more in the world of Lyme to manage a cyst form of the Lyme germ. Okay. Anyhow, what I find in my practice is that I will use itraconazole if I've tried treating intestinal yeast and somebody's yeast seems to have developed some resistance to the fluconazole, diflucan. I then will often try itraconazole, and I find it to be effective quite often, okay? I also clinically have seen it treat vaginal yeast as well, too, all right? Now, I know they don't have approval that the company that manufactures itraconazole did not go out and seek FDA approval to have it labeled as something that would treat vaginal yeast, but my experience is that it would. And so, yeah, I think you can do that. And then in terms of does itraconazole kill off the healthy yeast that lives in our intestines called Saccharomyces boulardii? I don't honestly know. I haven't looked at studies on that one to tell. I routinely do not resupplement it after somebody is on it. The times I will think about doing Saccharomyces boulardii, though, is if I've got somebody that I've had on yeast killers and or antibiotics, and they start developing a lot of watery diarrhea or bowel dysfunction. It's at that point that I sometimes will add in Saccharomyces boulardii. Okay, that tends to be how I do it in my practice. All right, but you do raise an interesting point. It makes you wonder if it would be a good idea to actually use Saccharomyces boulardii as a rescue remedy, if you will, after you do an itraconazole or a fluconazole or a voriconazole or a ketoconazole. Okay, it makes you wonder about that. All right. Good luck to you, Anna. Thanks for raising that point. Hello, Dave. Hi, Dr. Ross. Thanks for doing this webinar. You're welcome. I'm trying to improve my digestive health. In a previous webinar, you mentioned that you like 2 different probiotics, Probiotic and HMF Forte. Would you use both of these products at the same time, and how much of each would you take? Also, would you also recommend taking Thorn Sacro B? All right. So let me talk. Let's do probiotic talk here for a minute, okay? So probiotics are basically germs that are help the intestines to function healthily. They can include bacteria as well as a yeast, a healthy yeast, okay? So Sacro B is a healthy yeast that lives in our intestines and helps with intestinal function. Also, it is something that can be used as part of treating Clostridia difficile or C. difficile, which is a bacteria that lives in our intestines that can grow too much when you're on antibiotics. Yes, a bacteria that grows too much when you're on antibiotics. And if Clostridia difficile or C. difficile grows too much, it leads to watery diarrhea. All right. So Sacro B can sometimes be used to prevent that from happening. So for instance, if I've got somebody in my practice that has been on antibiotics and then they get C. difficile, when I have them go back into treatment again, as part of their treatment, I always supplement with Sacro B. And in those situations, I've never seen somebody get a second C. difficile infection before, in my practice at least. Okay, I'm not saying it couldn't happen, but I haven't seen it happen. So I do believe it does give some protection against getting C. difficile. All right, now the Probiotic is what is known as a spore-forming probiotic. And HMF Forte is something that uses human strains of bacteria that are found in our intestines. All right. So what's the difference between those? So human strains would be things like Lactobacillus bifidus, Lactobacillus acidophilus, Bifidobacterium would be human strains. And human strains are ones that are found in our intestines naturally. Okay. All right. Spore-forming probiotics are not found normally within our intestines. They come from the soil, actually, and they form spores. And so the idea is that they may more easily get through the stomach than the human strains do. They may survive the acid better. From what I've seen of studies, the spore formers do not actually populate the intestines, but rather they support the good bacteria that are in our intestines to work better and to function healthily. They may also help your human strains to repopulate the intestines when you're taking them, like an HMF Forte, okay? So these days, the trend in doing probiotics has been to try to take both spore formers and human strains together. One way to do that is the Probiotic plus the HMF Forte, in which case I would have somebody do 2 pills twice a day of those. Research Nutritionals recently came out with a product called Multibiome, which is MULTI-BIOME, Multibiome, that has both spore-forming strains and human strains in it. And so that's another way to do it too. If you do that, I usually have people take 2 of those one time a day. In terms of Sacro B, I tend not to make it a base treatment of my substitution or support of the gut microbiome. So in other words, when I treat people, I usually will have them on a Probiotic, HMF Forte, or the Multibiome, and I'll have them take them the whole time they're on treatment because I know I'm hurting the good bacteria using either the prescription or herbal antibiotics. So I want to support that, okay? In general, though, I haven't been doing much in the way of Sacro B, although I will add it if I get into a situation where somebody has developed a lot of gassy, watery diarrhea. No matter what we do, we can't get it stopped. I will use that. I'll add Sacro B in there. I also add Sacro B in if I've got somebody that has a history of C. difficile. I definitely want to use it in those situations as well, too. Okay? And I would do all 3 together. I would do a spore forming and a human strain and a Sacro B in situations like that. Okay. Dave, thanks for that question. Hello, Patsy. Let's see. Hi, Dr. Ross. Thank you for doing these webinars. You're welcome. Let's see. Can you please explain the difference between biofilms and the fibrin nests that happen in Bartonella and Babesia? How are they formed and how do they operate? So I tend to think, so let me kind of define terms. So, and this is something I discussed last week with you too. So let me talk about biofilms first, and then I'll talk about fibrin nests. So biofilms are layers of slime and protein that form, that cover certain bacteria. And they occur in and outside of blood vessels, okay? And wherever the germ is, they can do this. They can grow in the extravascular space and the extracellular space around your cells, all right? So germs and these biofilms also, so what they're composed of is a mucopolysaccharide sugar slime. That's a mucopolysaccharide, held together in a protein skeleton made of fibrin, all right? In addition, within the biofilm, there are communities of other bacteria and organisms that live in this biofilm that provide all kinds of functions. These biofilm also have tubes through which garbage was released to the outside world and tubes through which nutrients are taken into the world. Okay, so these are really complex communities, basically. All right. All right. Now, as I understand, the fibrin nest that I was describing last week, and also known as, which also could be called plaques, are basically composed of bacteria like Bartonella, interwoven with fibrin. Okay, and without the mucopolysaccharide slime and without all these other bacteria communities, all right? And these form primarily in the blood vessels themselves, and they can attach to the lining of a blood vessel, in which case we call them a plaque. It appears Babesia can do the same thing too, all right? So the difference, as I understand, is a biofilm is a much more complex thing. It has communities of bacteria that are not tick-borne bacteria. It has waste channels. It has a local post office. I mean, these are complex communities versus these plaques are probably not as complex as that, okay? And these nests are probably not as complex as that. All right. The other big difference would be, my understanding is these nests and the plaques exist within the blood vessels themselves versus biofilms can exist anywhere, okay? All right. Thanks for your question, Patsy. Hello, Sharon. Let's see. Hello, Dr. Ross. I want to ask you two questions. One is it worth to do the vaccine booster if I have Lyme? I had the first two Moderna. And the second question is, how has your experience been with Dapsone for chronic Lyme? All right. Both good questions. All right. So whether or not to get a booster is an interesting question. Okay. So it's clear with both, I guess now with the Johnson & Johnson and the Moderna and the Pfizer vaccines, that the data suggests that for certain people, that the longer it is after they have gotten the vaccines, that there will be waxing immunity or waning. I guess waning means decreasing, waning immunity. And that therefore at a point you might want to get a booster, okay? So what the data tells us is that the people that get decreasing immunity are people 65 and older. So yes, if you're 65 or older, get a booster, okay? All right. The second group of people would be people that are immunosuppressed. And by immunosuppression, what they mean are people that have are on medications that are specifically suppressing the immune system. These would be people like people that have had organ transplants, for instance, okay? These would also be people with certain conditions that we call immune suppression conditions, like people that don't make enough antibodies on their own, people that have low gamma globulins. Okay, so these would be people that would be defined as immunosuppressed by the medical community, not because they have Lyme disease, but because they have other conditions. Okay, now one could make an argument that people with Lyme have immunosuppression, but I have to tell you, I don't think that's the case. I think there's an immune imbalance that many people with Lyme have, where they're overly turned on in the way of inflammation. But I think that most people with Lyme do not have true immunosuppression. Okay, I want to let you know, though, that in the way that the CDC and others have defined immunosuppression, it's not looking at Lyme. It's looking at, are you on less steroids at suppressive doses? Okay, so not Cortef at 30 milligrams twice a day, which is more physiologic support of your adrenals, but rather suppressive doses of steroids, for instance, okay, or being an organ transplant person, okay. And then finally, the other group of people that seem to have enough waxing or waning, I always batch that up, decreasing immunity, would be people that are age 55 and older, but also have a chronic health condition, such as heart disease, diabetes, blood pressure. And although the CDC and the FDA did not specifically say that should include people with Lyme, you might put a person with Lyme in that group. Okay, so I would say if you're 55 and older and you got pretty bad Lyme, you might consider getting it too. Beyond that, I don't think other people should be rushing to get their boosters. You have to keep in mind, the boosters, the main reason I've recommended people get it, the Lyme or the COVID vaccine, the main reason I've suggested people get it is you want to prevent harm. And that harm could be from getting COVID and dying from it, or getting post-COVID syndrome, et cetera, okay? All right. But you still have to weigh it out against the risk of the vaccine. And although the vaccine appears safe for most people, there still is a risk that you trigger more body inflammation, or that you get some of these strange but rare conditions that happen from getting the vaccine. So I really still suggest only get it if you really need it in terms of the booster. I think everyone should get the vaccine, at least get the first 2 doses if it's Pfizer, Moderna, and 1 if it's the Johnson & Johnson. But beyond that, just because you can get a booster does not necessarily mean it's a good idea, because unless you're in one of these higher risk groups, like I just said, you run the risk of getting possible harm from the vaccine, meaning you get one of these strange reactions that sometimes people get when you already, and it may not be worth it when you probably still have a well-functioning immune reaction that would happen if you got the COVID, because your vaccine still works well. Okay. All right. I hope that answers the question for you. All right. And then in terms of the Dapsone, so many of you are familiar with Dr. Horowitz, who is a physician out on the East Coast that has written books about Lyme and came up with a Dapsone protocol. So what is Dapsone? Dapsone is a medicine that we traditionally have used to treat leprosy. Okay, and leprosy is a condition that has, like Lyme, is difficult to treat. Often takes years, months and years to get well, can have persister cells, etc. And Dr. Horowitz was wondering maybe one of the medicines we use for leprosy would help, and that's Dapsone. Okay, so he's done some research and he included Dapsone in his regimens, and his regimens also included rifampin, Dapsone, some type of an intracellular antibiotic like a doxycycline, clarithromycin, azithromycin, minocycline, and then also included Plaquenil, and also included something called Ceftin. Okay, that was his basic regimen. All right, so a lot of different antibiotics. And then he researched using that, and his initial research was on a protocol trying to get people to 100 milligrams of Dapsone with all those other antibiotics. And his research on that original dose of 100 milligrams showed that about 55% of people had improvements. And so everyone started rushing to doing the Dapsone protocol. All right. But buried within his data was some stuff that was interesting. And that data showed that the improvements that the average person got were only about 5 or 10% improvement. Okay, so this wasn't the wonder drug, but it still gave people improvement. The other thing that was buried in his data was the ugly reality that it's a hard medicine to take. and that about 45% of people would drop out of his research because they couldn't tolerate the medication. All right. So building on that, then he wound up doing another protocol, which was to take people up to 200 milligrams of the dapsone while being on cefuroxime, and then either doxymino, clarithromycin, azithromycin, and rifampin and Plaquenil, but trying to get them up to 200 milligrams on the dapsone. And in that, then I think around 30% of the people that could do that were getting into some extended remission. I believe that's what the number showed. Okay, but in his second study, he didn't report how many people dropped out. he didn't even address that. Okay, so what in my practice, what I've done, I have a few people that have been able to get to 200 milligrams. I have not seen anyone having sustained benefits. I have had people do the 100 milligram dose and they can tolerate it. It's a much more tolerable dose. And I use the things to make it more tolerable, like being on methylene blue if you need to be, being on glutathione, being on a number of things that he recommends, like folate, to make it more tolerable. But it still is hard to get up to that 100 milligram dose. Of the people that I've used the 100 milligram regimen on, I've had some really good improvements. I had one time I had a nurse that had seen other providers for years that had been on IV antibiotics, made little headway. We did some things in my practice, and then we learned about dapsone, put her on it, and within 2 months of being on it, she was ready to go back to work after not working for years, and years afterwards is still doing great. All right. It was the drug that saved the day for her. Other people, it helps me maybe about 50% of the time in some of my patients. My sense is overall, I think it's worth a try. I would give it about a 4-month try and see if it's going to make difference, and also at a level you can tolerate. But if by 4 months it's not giving you benefit and you're doing the other parts of his protocol that supports you, then I think it's time to look beyond doing it. Okay. On the whole, what percent of people do I think get benefit? I think maybe 30%. It's not the big game changer for the majority of people. I think Dr. Horowitz is a good cheerleader for his protocol, but in the end, I don't think it is the great game changer that some of his earlier data suggested. But again, he didn't promote the fact in his early data that 45% of people had to stop because they couldn't tolerate it. Okay. So anyhow, there you go, Sharon. Thanks for that question. So if people want to read more about his protocol, that dapsone protocol, both the low and the high dose, let me just show you where you can read more about it. Okay, so let's see here. All right, so ultimately dapsone is used to help persisters, okay? And so here's an article I've written about how to treat persisters, looking at dapsone and other methods. And in here, you'll find information about disulfiram, for instance, okay? And then the dapsone I write about here, if you want to see a full dapsone article, it's this one here. So it's called Dapsone for Lyme Persisters, a Miracle Antibiotic with a question mark, okay? So yeah, for some people it can be, but other people, it's not the thing that gives you the big breakthroughs, all right? Okay. Oh, if you do it, as I mentioned, because it can be hard to take, you've got to do some things to support yourself while you're on it. And those things that I recommend that people do in addition to the antibiotics are to be on curcumin, be on glutathione, and be on folate, okay? And for the high dose regimen, in addition to doing folate, you may need to be on something called methylene blue to keep from getting methemoglobinemia, okay? And I described that here as well too, all right? All right, good luck to you, Sharon. All right, looks like we got another question from Sharon. Let's see. Hi, Sharon. I think it's the same Sharon. Maybe it's not. Maybe it's a different Sharon. Let's see. I have 3 questions. In your October 21 webinar, you talked about the usefulness of lumbar kindness as a fibrolytic agent in treating Bartonella. What about heparin? Do you use it in your practice for similar purposes? Number 2, I have heard Dr. Burrascano and Stephen Buter recommend arginine in the treatment of Bartonellosis. Do you have any experience with it? And 3, I know methylene blue is used as a tissue dye in biology labs. Would it stain our insides blue or any of our organs? Thank you. Interesting question. Let's start with the methylene blue. I'll work backwards here. So methylene blue, everyone, is a substance that I have been using in my practice to treat for persister forms of Lyme, persister Bartonella, also can treat growing Lyme and growing Bartonella. And that's based on laboratory experiments that were conducted by Dr. Ying Zhang in his lab at Johns Hopkins University. In terms of how it works, we think it destabilizes the covering of the germ. And when it destabilizes it, it doesn't need a growing germ to cause the germ to fall apart, basically. Okay, so that's how it kills it. It is a very messy substance, all right? In fact, it's manufactured in an intravenous form because it's used to treat a condition or approved to treat a condition which is called methemoglobinemia. And in methemoglobinemia, some people are predisposed to having their hemoglobin, which is in the middle of your red blood cells. Hemoglobin carries oxygen. Some people in methemoglobinemia, their hemoglobin doesn't easily release the oxygen. And if they go into a crisis where they're just not getting enough oxygen delivered to their tissues because of this problem, you give them IV methylene blue, and it acts to bump the oxygen off of the hemoglobin, okay? So your tissues suddenly get oxygen. That's what it's made for, okay? Now, in this country, in the United States, we're now having it turned into a pill form by compounding pharmacies. But the average compounding pharmacy does not want to touch the stuff. And that is because it is messy as hell. And it stains everything blue, just like you're talking about, okay? So you have to have a special hood. You've got to have labs set up a certain way to do it. So in the States here, the pharmacies that are doing it are PD Labs out of Cedar Park, Texas, just outside of Austin. Hopkinton Pharmacy up in Hopkinton, Massachusetts is doing it. And InfuServe down in St. Petersburg, Florida is doing it. Those are the only 3 companies I know doing it. I admit there may be others, but those are the ones I know about. Here in Washington State, I couldn't find any of my compounders to do it at all. They just would not touch it. So yes, it stains everything, okay? And what that means in terms of practicality, when you're using it, you're going to pee out blue. You're going to poop out blue, okay? Things are going to come out blue. And when it hits your toilet, it's going to be, you're going to have to scrub the stuff out. And from what I understand from my patients, it can be difficult to get out. Okay. So just, I want you to be aware of that. Now, does it stain your insides blue? I honestly don't know. I haven't seen any information about that. It's a really great question. I don't know. It's a good question though, but I don't know. Let's see. Number 2, arginine. So arginine, one of the things that Bartonella can do is Bartonella can grow along the endothelial cells that line your blood vessels, okay? So grow in and on. And one of the conditions you might run into with that is the swelling created by that infection may act to limit blood flow into areas. Arginine has the ability to be a good vasodilator. It can help open things back up. So in theory, arginine may make a difference in Bartonella treatment. To be honest, I haven't been adding it to my treatments. I understand the theory. In general, I'm finding I don't need to go there. That usually just using treatments that have a good mix of antibiotics to treat the germs will work. And more recently, again, I'm starting to add in fibrin busters to break apart these nest and plaques that form with the germs, okay? All right, heparin. You know, heparin could be a fibrinolytic. I choose not to use it in my practice because I'd rather not have people having to do the injections of it, basically. And I choose to go more the lumbar kinase, which has a great ability to break down fibrin. without having people carrying around heparin and having to do injections. That's not to say heparin couldn't work. It's just that from an ease standpoint, I've been tending to use more the lumbar kinase in my practice. Okay. All right. Thanks for that question, and good luck to you. Hello, Robert. Hold on here just a minute. Hi, Dr. Ross. My older brother, mid-80s, diagnosed with COPD, recently had a sudden onset of pulmonary fibrosis with scarring on half of lungs. Is O2 and NAC, or he's on O2 and NAC. His doctor said it was probably due to stress. Could black mold mycotoxins possibly be the trigger? His house had water damage and moisture was trapped in the attic from a blocked vent. Black mold was discovered. He is now moved but lived in the house several months with the mold, so it has not a long-term exposure and he doesn't smoke. He was also told nothing can be done about the fibrotic damage. Do you think lumbar kinase may benefit him by possibly repairing some of the damage? I'm finding anecdotal evidence that it may. Thanks so much. So, Robert, I haven't seen any literature or scientific information suggesting that mold biotoxins or mold exposure itself would lead to scarring of the lungs. I'm not saying it couldn't. I'm just not aware of any data that says that, okay? In terms of whether the lumbar kinase could help, it might, but I'm not aware of any data that shows that either, okay? So I would say maybe, but I don't know. All right. Thanks for that question, Robert. Good luck to you. Hello, Charlene. Let's see. Dear Dr. Ross, 2017, I have blood removed and oxygenated put back. 3 parts, Monday, Wednesday, Friday. And on Friday, to my horror, I saw 1 1/4 inch tube, dull orange and substance, and too big for the blood vein and slowed things down. 2019, my blood pressure went up, so I think there are probably more. Vortic bit 837 genes as opposed to regular tick 32 genes. What type of doctor could I see about removing these? Doctor, we're done. No answer. Thank you kindly. I don't have any idea, Charlene. Sorry about that. I'm not aware of how to approach this. Good luck to you. Let's see. Hello, Dan. Let's see. Recently found that I have Lyme and Babesia and iron overload with no genetic cause for it. I have been told that infections like Lyme or Babesia can cause the body to store too much iron. Is this true, and what can help? Gosh, I have not seen data to suggest that Lyme and or Babesia cause you to retain too much iron. I just haven't seen that, nor am I aware of any literature on that, nor is that something I think that most of us that treat Lyme would suggest either. So I don't know. I don't agree with that, actually. All right. Good luck to you, Dan. Let's see here. Hello, Sharon again. Hi, Dr. Marty. Thanks for what you do. You're welcome. If I'm eating 30 minutes before taking binders and taking digestive enzymes with food, will the binders interfere with the digestive enzymes? It's a good question. Okay, so let's think about that. So the binders are supposed to bind up fat-soluble materials, okay? Digestive enzymes are proteins, so they're not fat-soluble. So in theory then, the digestive enzymes should still work. I think you'd be okay giving it a try. You know, if it doesn't work, you're gonna have a lot of symptoms like you had before you started the digestive enzymes, all right? So I'm not sure what your symptoms were, but often if people need to use digestive enzymes, if they don't use them, they're going to get watery stools. They may have gassiness and bloatedness, all right? So if you start using your binder and your digestive enzymes don't seem not to be working anymore, it does mean that the binders are probably binding them. But in theory, the binder shouldn't bind them. Digestive enzymes are proteins, okay? And a binder does not bind protein. Binders bind things that are fat, all right? Good luck to you, Sharon. Hello, Rich. Let's see. In last week's webinar, you mentioned taking lubrikinase to help break down fibrin in your blood vessels. Would it be okay to take 4 capsules of 20 milligrams each every other day? By alternating days that you take it, you can take a binder product on the days that you do not take the lubrikinase. This makes it easier to get all the proper staging in when you do take products on an empty stomach. Would the lubrikinase be just as effective doing it twice the dose, but only every other day? Maybe. I mean, the only way to really know would be do some studies, okay? Do an experiment where you do the way you're suggesting and do it another way, okay? All right, so I mean, that's the only way to know, okay? But I don't think so. And again, I'm just giving you an opinion, okay? I think that the way that you want to be more consistently breaking down your fibrin all the time before new fibrin stands can attach to the old ones and grow the fibrin back, okay? Because keep in mind, you got fibrin circulating and being made in the blood system all the time. In a period of time when you're not breaking down your fibrin, more fibrin can grow and attach to the existing fibrin. So I would be concerned, at least based on that idea, that you're kind of fighting against yourself if you're not actually doing a fibrin breaker all the time, okay? All right. Good thoughts, but that would be my thought on it, Rich. All right, good luck to you. Hello, Julia. Let's see. Hi, Dr. Ross. Have you heard of the PKIV protocol? If so, what do you think of it? Also, is it okay to take a high dose of mold binder twice a day instead of 3 times a day? It's hard to take a binder 3 times a day. Okay. So your binder is, you could take more all at once. The trouble is your binder is only going to bind what is in your stomach at that time. And the mold toxins are being released into your intestines and stomach throughout the day, all right? So, if you do it only once, you're just getting one hit of pulling them out, and you're not doing anything about other toxins that are being released later in the day. I have found in my practice that it is more effective to take your binders more often and to not take everything at once. That I just have found it to be a more effective way, okay? The PKIV protocol is a way of rebuilding phospholipid membranes in your body, including those that are found on your mitochondria and those that are found on your nerve cells. So your nerve cell membranes and the mitochondria energy factory membranes in every one of our cells are composed of phospholipid fats, a variety of those. So for instance, phosphatidylserine and phosphatidylcholine would be the 2 main ones. When you get a PK, as I understand the PK protocol, is that you get infusions of these phospholipid fats in addition to some other things that they do with it too. But essentially, it's designed to help rebuild tissues and your mitochondria membranes in the body. Some people report benefits, some don't. It's one of those things, like all the things that we do in Lyme. It's kind of hit or miss as to whether it works or not. Okay? All right. Good luck to you, Julie. Oh, the way that I like to do phospholipid repair, rather than doing a PK protocol, is I like using phospholipid supplements that are designed to repair the covering of your mitochondria. Your mitochondria are your cell energy factories, everyone. By some estimates, we have about 300 to 400 mitochondria per cell. Inside mitochondria is where sugar and fat are burned through a bunch of chemical reactions to create cell fuel. Cell fuel is something called ATP. When you have chronic infections, sometimes the oxidizing agents that are made by the white blood cells to get rid of those germs will also lead to damage of the mitochondria membrane, all right? In addition, inflammation can lead to injury of the phospholipid membranes that make up your nerve membranes as well, too. So there's a few products I like using in my practice that can rebuild that phospholipid membrane. One of those is a product made, or they're all made by Research Nutritionals. One is a product called ATP 360. It's made up of those phospholipid fats, in addition to a bunch of micronutrients that help your mitochondria work better. 3 pills 1 time a day. It replaces an older product, which was called ATP Fuel, similar product, but the fat substance, the phospholipid substance they use in the ATP 360 seems to be more effective and seems to be better absorbed, at least from the results that I'm seeing, okay? Now, the other product that Research Nutritionals makes is something called NT Factor, and NT Factor is similar to those other 2 products, but the big difference is that it does not include coenzyme Q10 versus ATP Fuel and ATP 360 both include coenzyme Q10, which is an antioxidant used in mitochondria function. All right. Now, where that's an issue is if you happen to be taking a medicine that has atovaquone in it to treat your babesia, you should not be on CoQ10. So atovaquone is called atovaquone. It's also found in something called malarone, which is a combination of atovaquone and proquinel. And it's also found in Mepron, which is pure atovaquone. Okay. So if you're on malarone, Mepron, or atovaquone / proquinel, you do not want to be taking ATP 360 or ATP Fuel because they have CoQ10 in them. Okay. All right. Good luck to you, Julie. Hello, Fabian. Let's see. Hello, Dr. Ross. Many thanks for your informed opinion. Oops. Hold on here a minute, everyone. I got a real scratchy throat here all of a sudden. Let's see. I'm following the Dr. M. I think you mean Dr. Mosignani protocol against Bartonella. This regimen does wonders on the Bartonella symptoms: shin bone pain, intense brain fog, retrosternal pain, and I decided to drop minocycline after 9 months. But voila, after 2 weeks without minnow, air hunger, anxiety, nausea comes back. This feels now more as a pure babesia picture. Minnow and clarithromycin may have silenced BAB so far without killing it. My partner is also under treatment, but he is still taking rifampicin and has not switched to rifabutin yet. What molecules, herb tincture, and at what dosage would you add to address an apparent babesia infection on top of the following Bartonella protocols, which includes clarithromycin, rifampicin, clarithromycin, rifabutin, and the other one is clarithromycin, rifabutin, minocycline. All right. So, So if you wanted to turn either one of these, and I'm not saying I agree with you that you have Babesia, but your question is, because I would need to ask you more questions, okay? But if I have somebody that has both Babesia and Bartonella, a simple thing you could do to either one of these regimens to turn them more strongly into a Babesia treatment would be to add the herb called Cryptolepis. And I would get a 5-to-1 or 1-to-5 mash, basically, which is 1 part of the herb to 5 parts of the alcohol that's in the tincture. Okay, so 1-to-5 mix. And Cryptolepis I would do it as a teaspoonful 3 times a day. It is very useful antiparasitic, and came to us. We learned about it because the people from Ghana and Africa were using it to treat malaria. All right. And so, as you know, when we treat Babesia, we use antimalarials. 5 milliliters 3 times a day is what I find to be an effective dose. And you could add it nicely to either one of these regimens. There may be some added advantage in using it too. And this is based on research that comes out of Dr. Ying Zhang's lab at Johns Hopkins University that got published earlier this year, which shows that in laboratory experiments, Cryptolepis is useful at treating Bartonella. We didn't expect that, but it does. It treats Bartonella. It appears to treat growing and persister Bartonella, okay? So you pick up treatment on the persister side here, okay? So that would be something to add. The other thing you could add to either one of these, you could add a Malarone into either one of these two, although bear with me here, man. I got to just look something up. I'm thinking I want to make sure you don't have an interaction between Malarone and the rifampin. Hold on just a minute. So Malarone would be a prescription. And Malarone is made up of, oh boy, it would help if I could spell here. Somewhere around here, I have some glasses. Hold on here a minute. There it is. Yeah, probably not good. Probably I would not mix Malarone with this. I think it's a simple way that you could do to make it more of a Babesia treatment. I would just add the Cryptolepis to it. All right. Good luck to you. Thanks for that question. Fabian, though, to be honest with you, I'm not your physician, and you should run this idea by your physician to make sure that it's something appropriate. Okay. All right. Hello, Z. I'm an MD treating tick-borne disease. What do you think of the new labs doing tick-borne testing, Vibrit, DNA connections, and others? So DNA connections, I don't care for. They haven't done adequate validation studies on their testing to show that they work. And I frequently will see people coming. My practice tends to operate more as a place where people come after they've seen many other physicians looking for ways to get better. They often come in with testing done by other providers as well too. So I think DNA Connections has done a wonderful marketing job, and they've done a great job of reaching out to people more in the integrative medicine community, and especially the naturopathic community. And when they broke on the scenes a few years ago, they did an effective job getting a lot of the naturopathic doctors to do their testing. And so I would see people coming in that were asking for help, and they would bring in these DNA Connections tests, and the DNA Connections would say that they had Bartonella or Babesia. But when I spent a lot of time asking people about Bartonella Babesia symptoms, they didn't have any of them. And I saw this a lot. And so it just had me questioning the validity of their testing. And so then I called up DNA Connections and I said, share with me your validation studies, your human validation, both your internal validation, looking at our analytic validation to look at an analytical level is what you're doing valid, and your clinical validation studies where I could see clinically if this makes sense. They didn't have that information. They hadn't done it at that time. So I question the credibility of the lab. Vibrant is new on the scene, and Vibrant has done good internal validation or analytic validation studies on their labs, and they look good. The Vibrant Lyme test actually has clinical evaluation, and in fact, they have published a study looking at that. I do believe that their Lyme method is valid. I still am not clear if their Bartonella Babesia, although analytically is valid. In other words, they've done to see if the test is analytically valid, but the clinical as to whether it really matches what's happening clinically with a person and in the field, I don't know. I know that in the discussion boards, there's a lot of discussion within the ILAS discussion board. I think there's a general feeling that Vibrant is not giving the most accurate results when it comes to Bartonella and Babesia testing. Okay, that's just the sense I get there. What I will tell you, I think that, although I know it's more expensive to this date, your best lab out there to do tick-borne testing is IGeneX. They have perfected their methods. They've been at this a long time. They do the validation work that's required of their test. And my own sense from working with them is they provide the most accurate results. And they also have validation studies they can share with you too. All right. So that's my feeling on the matter. All right. All right. Thanks for the question. Hello, Dave. Let's see. I have a product here that is serapeptase with inulin. Do you think this supplement can help with digestive health? I've heard about inulin being a good prebiotic. I do not know that much about serapeptase. Do you go over what that is exactly? Or can I go over what that is exactly? So inulin is a prebiotic. It can help support healthy bacteria. Serapeptase is an enzyme that I believe is more of an enzyme that breaks down sugar sources, basically. I don't think it is something that's going to break down protein. Let me just say that I'm not the best on serapeptase. I don't use it. I tend to use a lot more lumber kinase just because I know the effectiveness of it. Serapeptase, I think when I've looked at it before, is not a protein enzyme, but rather is a carbohydrate enzyme. But I don't know. As I'm saying that, I'm second guessing what I know. I'd have to look into it a little bit more, to be honest with you, Dave. All right. All right. Thanks for the question. Hello, Natalie. Let's see. Thank you for your webinar. So helpful. You're welcome. Let's see. What is your advice for highly sensitive people? My daughter, who has a positive ELISpot for Borrelia and Bartonella, is very sensitive to many things, including herbal antibiotics. Even a simple sprinkle of probiotics triggers neurologic impacts. So the biggest piece of advice that I can give you is to go low and slow. And what that means is, like for instance, with Bartonella and even Lyme tinctures, cat's claw notoba for Lyme and Psittacuta hutania for Bartonella, I might pick just one and start slowly. And even though those, I may eventually try to work my patients ideally up to 30 drops twice a day. And a super sensitive person, you might do well getting up to 1 drop twice a day. Honestly, okay? And so I try to tell my patients they're really sensitive not to get so caught up in the amount that they're taking, because what I believe is that when somebody is super sensitive, part of the reason they're so sensitive is their liver's ability to detox and remove these antibiotic chemicals we give them is impaired. All right. So when you try to recover from Lyme or from Lyme and or Bartonella, you need to kill the germs. But if the body's ability to remove your Hootenea and remove your Sitta acuta is impaired, you don't need to put as much in to give a good level that kills. Okay. So number one advice is go low and slow. Give up on the idea of reaching 30 drops twice a day. Be glad if you can reach one twice a day. I've had people recover on that. Okay. Number two, people that are super sensitive often have Bartonella. That's just been what my experience is. So I would look for it, consider either testing for it or looking at enough symptoms to see if you have it. All right. Number three, in super sensitive people, I also want to make sure that they don't have mold toxin illness, because if they do, that can be something you're going to need to address. Number four, do things to limit mast cell overactivity. Mast cells are where your histamines are made. And that means probably taking out histamine or having a diet that uses low histamine foods. You can Google that, okay? And if you can, getting on things that control the mast cells so they don't make as many histamines. Mast cells are your cells in the body that get active whenever you have allergies or you have infections, turning them on too much. And the main chemical they release are histamines, okay? And so a good herb that can manage histamine excess is quercetin. And for that, I might start at 250 milligrams once a day. And if you can, work up to 500 milligrams twice a day, okay? And then finally, for the really sensitive person, you might also want to try to get them on some glutathione to help with detoxing. But you want to go really low and slow even as you start that dose, okay? So now what I'm telling you are just general ideas. To help your daughter the best, I would need to know more about her specific situation so I can help you figure out where do you dive in, even how do you start, because that can be the hard part. But those are some things to consider, okay? All right. Good luck to you. Good luck to your daughter. Hello, Jane. Let's see. Hi, Dr. Ross. Following a couple of years of symptoms, the only thing that came up positive was a skin biopsy confirming small fiber neuropathy, idiopathic. I've looked for causes and have antibodies for two types of Bartonella and Babesia, also mycotoxins in urine, negative for Borrelia. Low CD57 suggestive of mycoplasma. I believe I've had Bartonella for 30 years, but the small fiber symptoms have come up in the past 3 years. I'm 67. Is it too late to address the Bartonella? Can it be addressed without long-term antibiotics? Is small fiber neuropathy something you see with these diseases? So many questions. So my approach to small fiber neuropathy when I see this, so small fiber neuropathy, everyone, is neuropathy involving the small nerves, all right? And so not the big nerves that come out of your back and not the big nerves that run under your funny bone, but the nerves that split at the skin level into smaller and smaller fibers. They literally are fibers. And the way that you diagnose small fiber neuropathy is you have to do a skin biopsy and they stain them and they look to see what's happening with the small fibers, okay? Symptoms of small fiber neuropathy can be burning sensations, nerve pain, numbness. Those are the kind of things you might see. What can cause it? So first of all, neuropathy is tricky because about 50% of the time that somebody has neuropathy for any reason, we can't figure out why. All right, we call that idiopathic, meaning we don't know why. All right. What I have, keep in mind though that your neurologist don't believe in Bartonella and they don't believe in Lyme, they don't believe in Babesia, nor do they believe in mycotoxin illness. So, and what I have seen in my practice though is that Bartonella, Babesia, Lyme, and mold toxin illness can trigger small fiber neuropathy. And I have seen in my practice that if I correct for those by knocking germ load down And by removing those toxins, that sometimes, maybe 50% of the time, we can get patients' neuropathy to go away. I've seen that happen before, okay? In this kind of a situation, in terms of, so I think you asked, is it too late? No, it's not too late. And given what you've told me here, I'd probably work on both the Bartonella and and if you were in my practice, I'd probably suggest we start doing some binding of mold toxins as well too. In terms of how to treat the Bartonella, you could do antibiotics, but you could also do herbal antibiotics as well. The herbal antibiotics that I like using are Sida acuta and Houttenia. You can read my article about how to treat Bartonella, and I'll show that to you here in a minute, where I address how to use Sida acuta, Houttenia. The other thing that I would do is try to do some nerve support and repair. And specifically, I try to get inflammation down by getting your Bartonella and your mold toxins out, okay, but also using anti-cytokine herbs like curcumin. And I would do 500 milligrams 3 times a day. I would get on some glutathione because glutathione is the reparative antioxidant that works within every cell to repair injury and damage. And I would do that at 400 to 500 milligrams of a liposomal variety 1 time a day. The product I like for that is Trifortify by Research Nutritionals. And then the other thing I would do is work to repair your mitochondria and work to repair the nerve cell membranes. And that would be to use that ATP 360 that I mentioned earlier tonight, 3 pills 1 time a day. Okay. So to answer your question, is there hope? Yes. I have been able to turn it around in a number of people in similar situations. I cannot give you a 100% chance. I give you maybe about a 50% chance that you can turn this around. Okay. And based on what you wrote here, again, I'm just getting to see a few words that you put on the screen, but I do think it's possible. All right. Good luck to you, Jane. Let me do a screen share here for you. All right. So, Jane, the other thing you might want to look at is trying some of the peptide, that BPC 157 that I mentioned earlier tonight too, that can repair injury. Now, I have to tell you, I've just started using it in my neuropathy cases, or patients that have neuropathy, but in theory, it might do a good job for you as well. Okay. All right. So in terms of how do you treat Bartonella, take a look at my infection treatment plan section here. Take a look at my article about how to treat Bartonella, including growing and persister forms. All right, and then in terms of the herbal options, where are we here? Oh, what did I think I'm in the wrong article here. What am I in? Oh, this is about persisters. Let me go back. I grabbed the wrong article. Here we go. Take a look at my article called Kills Bartonella, a brief guide. And then take a look down here at my tier 2 Bartonella approach, which would use Houttenia, Sida acuta, and liposomal oregano. I would probably change that so you could do either liposomal oregano, or you could do a liposomal cinnamon clove oregano, which is useful at treating growing and persister forms of Bartonella. Okay? All right. All right, Jane, good luck to you. Hello, Lee. Let's see. Good evening, Dr. Ross. Hope you're doing well. I am. Thank you. I was diagnosed 10 years ago post-treatment, 20 years with Lyme. So I was diagnosed 10 years ago post-treatment, 20 years with Lyme, Bartonella. I was diagnosed with having Hashimoto's disease. I've been on nature-throided levothyroxine. I've suffered from intense sweating, then extreme chills to the extent of needing a hot shower. I've lost a lot of hair as well. Could the thyroid test be false positive? The reason I asked is that I stopped taking the levothyroxine and the sweating has lessened dramatically. Just got not sure what's happening with causes of sweating and chills. Which supplements would you suggest? All right, so with the degree of, so first of all, I don't know your age. Okay, so a big thing that can lead to sweating and chills is perimenopause or menopause. So so depending where you are, that is something to consider. Okay. Another thing to consider that can give these kind of temperature fluctuations like you're getting is Babesia. And you have to wonder if you had Lyme and Bartonella at one time, did you also pick up Babesia that may have just not shown up as symptoms until now? Okay. So take a look at my section in the Treat Lyme at treatlyme.net, my Treat Lyme by Marty Ross MD. Look in the How to Diagnose chapter about how to diagnose Babesia. I walk you through the symptoms to consider as to determine whether you might have Babesia, giving you this temperature fluctuations, okay? And then finally, another condition that can give you a lot of temperature fluctuations like this is also known as dysautonomia, where you have an imbalance and regulation of how your adrenaline and anti-adrenaline systems are working. Often, as part of that, people will have paroxysms or POTS, which is postural orthostatic tachycardic syndrome, okay? And where you get periods of racing and skipping of the heart and then dropping blood pressure, et cetera. And the way you diagnose that is with something called a tilt table test, all right? So I'm not quite answering with the what supplements would you suggest, because what I'm suggesting is you need to look back even further than that. You need to figure out what the cause is, and then you can figure out what to do about it, okay? All right. Good luck to you. Thanks for that question. All right, everyone. That's it for me for tonight. And it's been good being here with you again. Again, I'm not sure when our next one's going to be. It might be next week, although usually I would take a week off at this point. But I may do it next week because I think I'm going to be gone. I think I'm seeing my mother the Thursday a week before Thanksgiving week. So anyhow, I know I won't be here for that. So I suspect we'll be back here again next week. Anyhow, take a look at tomorrow's email. You'll see when I'm up for my next set of webinars. And I hope to have that email out to you tomorrow morning, somewhere between 9 and 9:30 in the morning, so you can take a look at the recording of tonight's webinar if you missed something, okay? One other request, I would request if you can, share this with other people who might benefit. I'd appreciate if you do that. They'll appreciate if you do that too, all right? Good night, everyone.